take your seats so we can start.
S'il vous plaît, ceux qui sont dans les couloirs.
Please, if everyone could take their seats.
Je vais au moins mettre ça pour entendre ce qu'ils vont dire. Bien, on va devoir commencer, s'il vous plaît.
Okay, we are about to get started. And as was announced previously today, we have a very important item to address, and that is because our committee will be addressing this subject for the very first time, and that has to do with health standards for all people, and in particular the financing of these measures. We have somebody who will be presenting this subject to us. That is Dr. Flavia Bustreo, Undersecretary General of the World Health Organization. And I'd like to invite her to kindly step up to the podium to come and speak to us. And I will be freeing up my own space so that Sandra can now chair the rest of the meeting. Dr. Flavia, are you here, please?
Bien, donc je la cède la place.
Okay, you can now take my place. I wish you all the best.
Merci beaucoup, le Président.
Thank you very much, Chairman, and thank you, everybody, and I wish you all a very good afternoon.
And I'm really delighted, and it's a special honor for me to be with this distinguished panel that I invite immediately to come and join me. If we can please have Ms. Nkando Luo, Members of Parliament and Minister of Higher Education from Zambia, Ms. Pia Locatelli, Member of the Parliament from Italy, Mr. Prandip Kakatil, Director of Program Partnership from UNAIDS, Ms. Elena Baybarina from the Ministry of Health of Russia and also member of the Health and Human Rights Policy and Coordination Committee of HRP, and Mr. Adam Rayos, Associate Professor from the University of Texas. While the distinguished panelists come and take their place, welcome to all of you. I'd like to just say a few words to set the scene for this conversation and this discussion this afternoon, and explain that this conversation and this discussion is actually part of an ongoing collaboration that we have had with the Inter-Parliamentary Union and the World Health Organization to try and inform the decision-making that Parliament are often called upon making, especially in the area of science and especially in the area of health, and to make sure that this parliamentary decision and parliamentary action, including the policy legislation, the financing, the advocacy and accountability that you exercise, that are informed by the best science and evidence that is available, and that also that the new research findings that are always generated progressively time by time, that they are brought to the attention of the members of parliament, and they inform the discussion and debates that happen in many countries. We at the World Health Organization are aware that very often the debate and discussion that relate to the Agenda for Sustainable Development, it's a unique opportunity for setting an ambitious, integrated and transformational agenda in the countries, and that having that agenda supported and sustained by the policy evidence that is required makes it for a much easier and productive political discourse. And among the areas where that political discourse is very, very important, clearly health is the critical dimension. And the panelists today with me, they will illustrate how much that health is important in the political debate and discussion in their own countries, and they will explain also how much the conversation and the discussion within the different parliaments, how beneficial it is that that discussion is informed by evidence. I'm especially proud and particularly honored that this panel comes after this year at the World Health Assembly in Geneva. We had a panel with almost 60 members of the parliament that came at the time of the World Health Assembly together with their ministerial delegation. And it was a very, very fruitful dialogue that we look forward to have today. Also, some more update and some more discussion. It's also, I wanted to say, we have, together with the colleagues from the Inter-Parliamentary Union, we have identified some areas within women, children, and adolescent health to exemplify some of the challenges that happen in the political debate in Parliament. And particularly, we will have speakers that will focus on immunization, on women, children, and adolescent health, including sexual and reproductive health, that sometimes can be quite challenging for debates in Parliament, and also epidemics and outbreaks, including some of the more challenging, like Ebola in sub-Saharan Africa, Zika in the Latin American context, cholera currently in Yemen and in other parts of the world, and maybe the next epidemic that will come in the future. So I would like to ask the panelists to please focus on these areas of work, and I will have for each of you a specific question that we'll try to direct in that direction. As the IPU tradition, we will have an interactive panel, and if you please, after the brief intervention by the panelists, if you from the floor would like to make interventions, this will be very welcome, and you will just need to raise the plate, and then Alessandra here will help me collect, and we'll make sure that we give the floor particularly to the members of the advisory group that are here with us on health, but also to all the delegations that are present. We really like to have this as an interactive debate. So let me just get straight into the panel and also straight into the questions, because I've introduced them already. So let me ask directly to the Minister of Higher Education from Zambia. Professor Luo, given your experience both as a minister and member of parliament, if you can please share your views on how Parliament can build connection with the science and research community, and also elaborate on how the members of Parliament get the information that they need to take informed decisions. And we would particularly be interested to hear, as I said, in the area of women, children, and adolescent health, which we understand your action has been particularly important, especially in the fight against child early and enforced marriage. Please, Professor Luo. And I'm told that each of the panelists has 5 minutes, and then somebody from the audience, UN, will signal when we are getting close to the 4 minutes. If you see something from that end. Please, Professor.
Thank you very much, and let me thank the organizers for affording me this opportunity to come and share some of our experiences in Zambia regarding the topic at hand. And I just want to state right from the onset that it's important that parliamentarians start making connections with the ministry that is responsible for science, research, and technology. In my own country, This is the Ministry of Higher Education. And currently we do have in Zambia what we call the library, where all the information is supposed to be collated and given to parliamentarians. But sitting in a ministry responsible for research and science, I feel that is not adequate. I think it's very important that it becomes a norm and a policy within Parliament that the parliamentarians get first-hand information from the researchers themselves, and they also take a deliberate policy to be reading the publications that are coming out. This is because now there are a lot of emerging health problems. For example, whoever thought that Ebola would come and ravage the entire West African coast? And that's why it's so important. Now, getting to particular issues that I would like to raise is that when you have direct connection with the scientists themselves, as an example in Zambia, we actually started reading publications on high infection rates in children regarding HIV. And then we started asking a question: why would we see children about 12 years, 10 years, 14, 15 that have HIV infections, but it was never transmitted to them through their mothers? Because what we all know is that there's what is called mother-to-child transmission of HIV, but then this you'd see it in babies, and as they grow up, you then start following up. But these were children who would be born HIV negative, but as they get to 10, 12, 13, they are HIV positive. And as we followed the scientific discourse and publications, we realized that these girls were actually catching their own infections. So we had to look at this whole spectrum and got the scientists to give us evidence as to where this infection was coming from. And then they did actually do a lot of research on children, and it was very clear that these children were getting infected because they were getting married early by their parents. So some of them were into marriages as early as 12 years, 11 years, 10 years, and they were contracting infections because of that. So as our parliament and our government started seeing these kind of patterns in the country, it was important, first of all, to start a campaign against child marriage. Secondly, it was important to actually do a strategic plan as to how, as a country, we're going to respond to this particular issue. And thirdly, it was important for us to start doing a legal framework that will respond. And for this to happen, even on the floor of Parliament, the parliamentarians should have access to evidence. So what we did is to make sure that the evidence on child marriage, the infection rates, not only now of HIV, but infections of gonorrhea, infections of syphilis, and some of them with cervical cancers at a very tender age, was made available to Parliament. And so the campaign in Zambia is not only a campaign of parliamentarians, it's a campaign of literally everybody in Zambia, the traditional leaders, the parliamentarians, the government leaders, the NGOs. It's a huge campaign now in Zambia, but this was based on evidence. If you don't have any research evidence, it's very difficult to convince people, even if you are a parliamentarian, that this is a problem within your community. So this is how we have gone about it in Zambia. And I want to conclude by actually sharing with us parliamentarians that we are now living in a world of science and research. And therefore, we cannot go to the floor of the House and start debating issues based on extrapolation. Because even the people that are listening to us out there are much more well-informed, and they would like to listen to debate that is robust, to debate that is scientific, and to debate that is going to be you know, to be rolled out. And finally, I want to say that as we look at the discourse that we have this afternoon, it's very important for us to know that even in terms of diagnostics now, in terms of treatment, we have to use science. And therefore, as parliamentarians, we need to be abreast. If you're going to look at all what has been achieved, for example, in the area of cancer, it's all based on nuclear science, full stop. If you are going to look at certain diagnostics of certain diseases, including HIV, it's all based on science. So we as parliamentarians have to take an interest in science and put it as our business. And in fact, we should be the ones even asking for higher votes in Parliament for more money to go into research and science. Time is gone now where you just want into Parliament and say, we want money. You must justify it. So I think this is an interesting topic. We can talk for the rest of the afternoon. But yes, science, research is the issue now, especially with the technology that is available to us. Thank you.
Thank you very much, Honorable Minister and Professor Luo, for giving the example, the clear example of how, with the use of evidence that related to the transmission of infectious diseases, both HIV/AIDS and sexually transmitted infection, you were actually able to inform your parliamentary action. And you were very eloquent in articulating how that evidence is important also for the challenge of the future, for the non-communicable diseases and cancer, especially women cancers, as you have articulated. Let me ask the second member of parliament that we have here in the panel, Pia Locatelli. Pia Locatelli, the IPU Assembly is a unique opportunity for parliamentarians and for all of us to learn the latest information on global health priorities and scientific evidence that can help guide the national decision. Can you share with us the experience that Italy has had recently in dealing with a very particular problem that we call in the science vaccine hesitancy, which is a result of a dissemination of misconception, false myth, and not based on evidence in opposing immunization. Recently, the government and the parliament have supported a strong action, and we would be delighted to hear from you how the challenge articulated. Please, the floor is yours.
Thank you, Chair. We had a very interesting experience, but not a new one. In fact, the dissemination of misleading, anti-scientific and delusional ideas, fake news and actual hoax is not recent in Italy and is not confined to health. A masterpiece of the Italian literature by Alessandro Manzoni, dating back to the first half of the 19th century, imagine, The Betrothed, the Promessi Sposi, details the tragedy of the unlucky people who were accused of spreading the plague through mysterious potions in order to serve the interest of undertakers and those who carried the sick. The same situation as today. Isn't it incredible? A century passed, and the internet came along, and the dissemination of fake news is still there and has become viral. In the case of vaccines, it seems it all started in the late 90s with a simple case of scientific fraud by British gastroenterologist Andrew Wakefield. Today, the situation in Italy. Today, part of the Italian population mistrusts vaccines, and it is difficult to overcome this feeling because, luckily, vaccines have been actually effective throughout all these years, and the perception of having escaped an imminent danger of a horrible illness has disappeared, and we forget. This is the problem. But this happy situation is thanks to the vaccines. Think of polio. I mean, I remember my friends with polio, and I'm not so old, but disappeared. And to prove in a counter way the fact, then it happened that in Turin, Italy, in the north of Italy, a 7-year-old girl was recently hospitalized in a critical condition for suspected tetanus. People felt the danger, and then what happened? When the news was published in the newspaper, the following day, as many as 200 people immediately went to the hospital. They reminded the risk, and they had vax. The problem is that the role of media is key in steering the perception of public opinion in this field, and according to a survey by the Italy's Censis Research Center in 2014, 42.8% of parents decided to vaccinate their children after gathering information online. How reliable is information online? Big question mark. And 62.1% were convinced that vaccine can cause serious illnesses. The role of media in general and social media. During this year, 2017, the situation in Italy has profoundly changed and worsened, and the government was obliged to take action without taking heed of protests by so-called no-vax movements, as a quick succession of cases of measles caused the death of 4 patients. And the last bulletin of the Ministry of Health shows that 4,652 cases of measles were reported in Italy until October 8th, less than a year, and in 88 of cases, the infection attacked unvaccinated people. This is worrisome because if you take the number like that, say 4,500 cases, but you have to compare. In the first semester of this year, Italy was the first country in Europe in absolute terms for cases of measles, and the 5th in the world after India, Nigeria, Pakistan, and China, but with the difference that Italy has a population of 60 million inhabitants, while the other 4 countries altogether account for almost half of the whole world population. Can you imagine? So, in view of the above, and also considering that 95% vaccine coverage is needed in order to be safe from measles, in Italy we are now minus 10%, 85%. 5 months ago, the Italian government decided to enact a decree to make children's vaccines, 12 children's vaccines, then reduced to 10, compulsory for children under 17. And it was rather late, and that was a fault, intervening too late, because it is not easy to fight against disinformation, accusing politicians and scientists to be under the thumb of big pharma, a sort of supernatural entity causing the onset of illnesses in order to sell drugs and vaccines. But also this is misleading because we spend on vaccines 1.4% of the total health budget. So no reason. And we explained it, and people could not accept it. And if you think that we spend 1 billion for stomachache, I mean, you compare. So, this is the decision the government took, supported by scientific evidence, and we couldn't but follow the government because scientific evidence was there on the effect of vaccines, but also to contrast the false information about money, big pharma making a lot of money. And we could have done better. We could have intervened earlier, quicker, so to say, challenging the falsely informed public opinion. We could have had a better coordination, and we could have set up an independent scientific committee, because science is, and science evidence must guide our campaign and also our political activity. Now we have, I know I'm over, we have to continue to fight on the battlefield of information and in the media. But I feel particularly committed to take on board in any activity, any political activity, my political activity, the role of science and science-based evidence. And to this, we must educate people from the very early years of their life. Thank you.
Thank you, Pia Locatelli, and thanks for illustrating how this phenomenon, vaccine hesitancy, is actually spreading across the world, including in countries like Italy of high income, and is generating a critical possibility of re-emergence of infectious diseases that were under control, like the case that you have illustrated of measles, but also other infections like diphtheria, like tetanus, and many other infections that we were able, because of the vaccination, to control. Let me move to another distinguished panelist, that is Elena Baibarina, and ask her, you, in your role within the Ministry of Health of Russia, you are very aware that the development of evidence-informed health policy and programming is not just the technical process of translating the science and the knowledge, but it also creates the requirement for a continuous dialogue between the health experts and the policymaker. And this is particularly true for the area of sexual and reproductive health, which is also, in many parts of the world, undermined by the dissemination of inaccurate information. Can you please share with the distinguished participants and with us your experience on how to bridge that gap and ensure that the health law and policies are continuously informed by robust scientific findings? And Ms. Baibarina will speak in Russian, so please, for the ones that don't have the microphone, please, you can hear her. Please, Ms. Baibarina.
Thank you very much, dear members of the panel, dear friends, dear colleagues. I agree with the importance of countering the anti-vaccine lobby and countering infectious diseases spread. But I would like to speak about the mechanism of interaction between experts and parliamentarians, the way we have it. Here, the Ministry of Healthcare works in close conjunction with the State Duma and the Federation Council, because we are doing joint things for the common good. We are interested in taking efficient, reliable, and accurate decisions and information dissemination. The Ministry of Healthcare has some of the major federal research and scientific centers that are subordinated to it in all the different spheres of medicine, oncology, infections, and many others. And all these institutions are sources of important scientific findings. The Ministry of Healthcare, they're called the staff of the extra staff members. So these academicians and professors with great scientific authority in their field, with great practical expertise and knowledge, that are advising the Ministry of Healthcare on some of the main issues. In building our interaction with the parliaments, the working groups that are created within the Parliament, whereas in terms of the maternity and child health, involve both ministry members and experts from the medical fields. So in terms of the healthcare issues of the greatest concern, we carry out roundtable discussions involving outstanding experts in the field, thus promoting the accurate and reliable information exchange. Apart from serious research institutions and centers producing their findings and expertise, the healthcare under the aegis of the healthcare and WHO, we carry out fundamental studies whose findings relate to all countries of the world. We are launching and expanding the project on children's hospitals, on perinatal assistance, and also actively discussing the prevention of the sexually transmitted diseases and infections dimension. One of it touches upon communication issues, how we can intervene shortly in terms of communication to change the behavioral pattern of people, because I think in prevention of sexually transmitted diseases is the most important thing, and also designing and developing the important sets of tests for diagnostics. Thus, due to these efforts, I think our parliamentaries are quite well informed about the most important and interesting scientific findings and evidence. Should there be any further questions, I'd be happy to take them, but I see that my 4 minutes have been exhausted already.
Spasiba большое, Varina, and thanks for highlighting the importance of that relationship that is so crucial for governments to make decisions. I see already people raising flags, but I have 2 more wonderful panelists to go, 2 gentlemen. I was a gentle lady. I gave the floor first to the ladies in this panel, but please put it up and then we will recognize you in a moment. So let me go straight to the other panelists and ask Dr. Rayos, I hope I'm pronouncing your surname, who is an associate professor from the University of Texas. We have heard the discussion and the conversation between the Parliament and the science, but what is the place of scientific evidence in the political arena? Is there an inherent tension between science and politics? And how can this tension be reconciled? Please.
Thank you. Distinguished members of the Parliament, distinguished members of the table. I think that this is a fundamental question on the issue of relationship between science and legislature, the work that you do. I'd like to start by saying that the scientific method is really based on the obtention of data, statistical analysis, and reasoning. It was actually geographically close to this, in this region, where a man who believed in universal democracy and international cooperation, Immanuel Kant, developed his philosophy of the imperative paradigm, which was the common good should really guide our actions. And I believe that it's time that we go back to that particular principle. I also would like to say that part of the reason there is this tension between science and politics is because of the way that each other see its reflection. The scientists tend to see the politicians as somebody who is divorced from knowledge or from understanding or from trying to find the truth. The politician tends to be the scientist as somebody who is in an ivory tower totally absorbed in himself. And in part, this had occurred because science over the last 2 centuries was really working in relatively small scale. It was really devoted to more analysis than synthesis. It was more concerned with understanding nature than with predicting its behavior. And a vast amount of knowledge has been accumulated based on that work. But the fact is, we are now in transition. And that transition is going to require that while we have all this knowledge, science is going to have to become bold. It has to become truthful in explaining its limitation and bold in its capacity to predict the future of natural behavior, particularly when it comes, for example, to issues like water shortage, natural disasters. So this tension can be resolved by the scientists and the politicians seeing each other not as 2 different entities or human beings. We are actually the same. Politicians take vaccines and scientists vote. And this is a maybe simplistic way to tell you that the most important activities of each field is actually exercised by each of us. And that means that we need to start a dialogue that is more humane and concerned with our interests. Politicians are judged in their behavior by the electorate, and scientists are judged by peer review. And the fact is that either field is surrounded and merged with the qualities of human beings. There's corruption in both camps, as well as there's virtue in both camps. And we have to learn to live with it. It's not like one is better than the other. We are just human beings doing or acquiring certain skills that through interaction can lead to the common good that Immanuel Kant promoted. And I know that lately there have been challenges to the question of does there is a common good? Is that something that can be achieved? And that's fine. I believe there is, and I feel that it can be achieved. Finally, I would like to remember that this scientific method, which is based on observation, experimentation, and statistics, is not totally unapplicable to social sciences, which is what most politicians do. In fact, Augusto Comte created the science of sociology and applied the scientific method to sociology. It is applicable. So that means that politicians need to understand how the scientific method is practiced. And we, scientists, need to appreciate how politicians go about at obtaining better goals for society and for their constituencies. We cannot continue to look at each other as aliens because we are not. We really are presumably looking for the same common good. It was Augusto Comte, the one who coined the word altruism. So we must adopt perhaps an international code among scientists similar to the code that physicians have with the Hippocratic Oath, where we practice science looking for the common good and restricted by our commitment not to do harm. As I have discussed as a young man with members of the School of Engineering in my country, Panama, they will argue that we, the students of medicine, thought that we were special. And my argument to win the discussion was, I will say, well, at the end of the day, we raise our hands and swear not to do harm. And most of the time, I'll be honest with you, I think we are so young that we don't understand what we're swearing. But most physicians stick to their oath. So I believe that scientists could, in a sense, sometime create an international code of ethics with a similar oath where we oath not to do harm. Just yesterday, I was mentioned the example of the Manhattan Project and how beautiful it will be if future generations can remember that there was a time when men and women of different parts of the world got together, worked together, and came out with a vaccine and not a weapon. So I think that we must move forward looking for a balanced air. We must move away from the obsession with growth. And then in looking that balance, I will quote a man from Colombia that I had the pleasure to meet very briefly, Gabriel Garcia Marquez, who said at the time that he won his Nobel Prize in Literature that the time has come to create a new world where good triumph over evil, where love triumph over hate, and those generations abandoned for 100 years of solitude will find the right place on the earth. Thank you.
Thank you very much, Professor Rayos, and also thank you for reminding us that the different professions at the end they have a common ethic ground that they can find, and for that call to find an ethical do no harm, that would be very, very welcome. And also, I think for the members of parliament here to remind that your role is always to look to the interest of public and work with a public health lens and agenda, and work with scientists that are independent enough to look at that public health interest. Let me come to the last of the panelists, that is Pradeep Kakatil, that from UNAIDS you have had a very special and long experience in establishing mechanisms of interaction with policymakers that include the voice of the scientists and also the voice of the civil society in this dialogue, and particularly the people affected by HIV/AIDS. So can you please bring your experience and share the key lessons that you have learned on how that dialogue can be facilitated, and what are suggestions and recommendations that you have for the MPs that are present? Please.
Thank you very much, Flavia. I hope this microphone works. Okay, yes. Great. Thank you very much. And after 4 excellent speakers, and I saw the number of flags that went up, I'll certainly make that I'm really brief and have an opportunity to hear from others. I started working on HIV, so I'm going to use HIV as a thread for the conversation and try and frame 3 or 4 recommendations that might be useful as we look forward. When I started work in 1991 on HIV, nobody had access to treatment in the country that I came from. That was India. The cost of treatment was $100,000 per year. And if you, a couple of years later, it came down to $10,000 a year per person. Nobody could afford that. Today, we have 19.5 million people across the world having access to treatment. 2 weeks ago, we helped negotiate the prices of drugs from what was 100,000 to 10,000. Now, the recent announcement that we made 2 weeks ago for the latest drug was $75 per person per year. Yeah? So it's absolutely incredible. Now, what made that possible? Was it research? Was it science? Was it information? And also maybe one other thing that we need to remember is that the early years that I spoke about, treatment to some extent was available in the developed world. There were new drugs coming out, but those new drugs were not available in the South. But today, the drug that we negotiated the price for is the latest drug that's being used in the developed world and in the developing world. Yeah? So that disconnect between who science serves, does it serve the whole world or does it only serve a part of the world? That transition has happened because of the AIDS movement. And maybe just 3 or 4 lessons, if I may very quickly go through. Number 1, data is important, but data that does not lead to action is useless. Okay, let me explain that. all of us know who is getting infected. Everybody, if you ask any of the scientists, any of the people, and maybe some of the experts are dangerous because they know so much about any issue that when they come and speak to you as representatives of the people, they give you so much information that's related to a very narrow area that it doesn't help you to move an agenda. Because what we need, and again, in any of these issues in public health, it's never about one issue, it's about multiple issues. The Member of Parliament from Zambia already raised the whole issue of it is not just about HIV being transmitted to young girls, but you have to first understand why young girls are getting infected. That is not coming from your laboratories, that's going to come from your communities. It's about practices that are there. It's about culture. It's about information that goes way beyond the micro details of science. So how do you really start bringing information that can lead to action, number one. Number two, the challenge that we had was that to bring the prices down on HIV medicines, on AIDS medicines, antiretrovirals, you needed to bring political leaders from the ministries of commerce, ministries of law, ministries of trade. You had to bring so many different sectors together because if you had to reduce the price, that has commercial implications, it has economic implications, it has legal implications, and that needs to come together. So you need to have that. We need to get out of isolating issues and isolating data and looking vertically in silos, but look across. So that's one. Number three, sorry. I can tell you, I'm bad in maths, so you can see that. I think what we really often do not do is we end up having a lot of information that does not connect the world between the scientists, researchers, and the implementers doesn't get connected. I'll take the example of a particular country. I won't name the country, but it had 6 people who were identified with, diagnosed for Ebola. And then we landed up there. We discovered that there were 947 people who had to be contact traced. The entire data was there. The CDC was sitting there with data. The French were sitting there with data. WHO was sitting with data. MSF had all the data. Now, nobody was acting on it. The disconnect between science and politics is huge. And what had to be done was how do you take the scientist to go to the right policy decision maker, and how do you really start looking at implementing those data? So that conversation needs to be brokered, and often that is where we fail. We do not broker those conversations sufficiently, and that's where we need to do. So, and then the last point that I really want to highlight is, because I've been told I have a minute, so is really when do you start engaging and learning information that needs to translate into policy action? I'll give you a simple example. Today, and there are 2 aspects to it. One, if I give you information that is legitimate, that's scientific, that is credible, there are many factors that will probably hinder you from taking action. I'll give you a simple example. I used to live in a country in Southeast Asia. Highest level of new infection is amongst gay men, okay? 42% of the gay men in that country are already infected with HIV. So I go to the minister and say, Minister, here's the data, this is what it is telling you. The minister says, yes, but keep that with you because I have my election coming up, I can't take this issue up. That's number 1, because all of us, elections are important. Number 2, more importantly, I said, okay, we have new information. If you start providing pre-exposure prophylaxis, it's just basically putting people on antiretroviral drugs, even if they are negative, so that they can protect themselves, they don't get infected, then you can actually stop the transmission. Now, the drug was available. He said, you should have come to me 6 months ago when we were discussing the entire policy for the country, the budget for the country, and it's 3 years since I had that conversation. They have not yet been able to introduce that. So many of us as researchers, we don't take the information and share it with you in advance so that when you're making policy decisions, you're using that to make decisions. So the lesson overall, if I may say, is we need to bring many other conversations together. How can we really start giving information, sharing information that really helps you to make decisions? How can we how can we bring silos together and have jointed conversation? How can we make sure that the information is timely and it helps you to act? And how can we really make sure that when you're acting, you also get real-time feedback on what is working, what's not working? I'll stop there, but I really look forward to hearing from you. Thank you very much.
Thank you very much, Pradeep, and especially for that wonderful experience and dramatic price reduction. I have to say, from WHO, we also have a similar experience, for example, in the development of the meningococcal meningitis vaccine, and particularly done in collaboration with India, and the Indian manufacturing at a low cost, and also with non-governmental organization called PATH. And that breaking down of the silos that you have illustrated has enabled the community to, in the space of less than 3 years, to develop a vaccine against meningococcal meningitis that is now being used in the meningitis belt of sub-Saharan Africa, like countries like Sudan and many others, where meningitis used to be such a severe and really a problem for children and cause of high mortality. So that experience you have highlighted is possible, is feasible, but it requires that triangulation and bringing the information, the knowledge about effectiveness, about the cost, as you are highlighted, to the policymaker at the right time, because then they can take the actions that I require. So this was basically the first hour of our panel. That was just like the starter for our conversation. If I may ask, please, that all the ones that have raised the flag, if you raise them again, that we then read who we have, so that we have a clear sense of direction. That's quite good, and it requires me to practice something I really don't like, which is enforce some discipline, because we have a little bit less than an hour, and we would like to capture all these wonderful inputs. And so if I can ask, if you can please, please, please try to stay within 2 minutes, max 3, because otherwise we are not able to capture all this wonderful reach. And if I can also please, excuse me, but maybe I'll give the precedence to the countries that have already, not to the countries that have already been here. So if I can ask the indulgence for the colleague of Zambia and the Russian Federation, we'll keep you maybe last, so that we see how we go, because it's just to try and be a bit democratic. Now, Alexandra, if I can ask you to read the list, and then if you're not in the list, raise the flag again. Alexandra, please go.
Thank you, Madam Moderator. So on the list we have Bangladesh, South Africa, Russian Federation, Slovenia, Jordan, United Arab Emirates, Pakistan, San Marino, Sudan, Panama, Iran, India, Morocco, Algeria, the Republic of Korea, Zambia, and Indonesia.
17 interventions, wonderful. So let us go straight, but before we do that, let me also remind you of one particular issue that, because we had a missing panelist, didn't quite resort from the interventions, which is how do government handle outbreaks? Because, the conversation here has been mostly about infections that do not come in the form of outbreaks. And of course, one would argue that HIV/AIDS, when it first erupted, could be considered an outbreak, but now it's an endemic disease, a disease that is there. But how countries and governments deal with the emergence of Ebola, the emergence of Zika, as I said, outbreaks of meningitis, all of that requires particularly discussion between science and policymaker, and it has the additional complication, if I can add that it needs to be very timely, because the decisions have to be very quick, and sometimes it involves decisions like, for example, enforcing travel restriction, enforcing quarantine. It requires decisions that sometimes by the public are seen as non-democratic. And so there is this additional element. If you can, at least some of you can reflect on that, that would be very, very welcome. So let's start our conversation, and I'll go straight to Bangladesh. We have a representative, Milat, particularly. I know you have some good things to tell us. Please.
And thank you, Mr. Chair, and thanks the panelists as well. I just make one or two comments on that, we don't have any option other than using technology, science and research to improve the health standard. So as I can give our experience from Bangladesh that we are using as a low middle income country, we have constrained a budget. Every country has constrained a budget. I know that we are using telemedicine, using mobile for getting treatment. We are also doing the monitoring with a mobile health team, and also using the evidence-based treatment. We are cutting down the hospital stay of the patient and also expenses of the patient. So, and also we need to be accurate to use the science technology in every treatment and every prevention of care. So I think it's not a matter of discussion, a matter of decision, how can we take it forward? Thank you.
But thank you so much also because you set a good standard for the conversation. And if I can ask, please, the distinguished delegate from South Africa to speak. Please, the floor is yours, sir.
Thank you, Chair. Our input is more related to the relation between the healthcare sector and global politics and trade. There's a need for a comprehensive and sustainable continental research ecology, which is vital, and it will involve the engagement of politics, but also huge financial injection, which the continent doesn't have. And one of the reasons is that the continent is experiencing wholesale looting of finances through illicit financial outflows, through base erosion, through profit shifting, and other tax evasion mechanisms. We'd like to implore other parliaments around the world to please speak to multinational companies, developed countries, to speak to multinational companies to stop this wholesale looting of finances, especially in the mining sector in the African continent. It's depriving the continent of much needed resources which could help us in the healthcare center. Thank you very much.
Thank you very much, sir, and definitely I know this issue is very much at the heart of Dr. Tedros Adhanom, the first Director General from Africa of the World Health Organization, and I know there is discussion about how can the organization actually help this dialogue to be productive. If I can ask the distinguished representative from Slovenia, please.
Thank you, Madam Chair. The aging population and increased life expectancy have put the issue of ensuring appropriate health care at the heart of our priorities. Hence, today's debate is an important one, and I welcome its inclusion on the agenda of this committee, since science is, in fact, the sector on which we are pinning our greatest hopes for new treatment options. Slovenia is aware of the importance of investing in science and research, since it is only new knowledge that can open up new pathways and for many brings new hope. Hence, Slovenia participates in international research infrastructures in accordance with the priorities of the 2011 to 2020 Research Infrastructure Development Plan. In this respect, the access of Slovenia research to major European and global research infrastructures is crucial, as only in such a way are we able to achieve and maintain the level of science in the state at the comparable European or global level. Slovenia currently participates in 2 international research infrastructures, namely the European Life Science infrastructures for biology information and the European infrastructures for translations medicine. In 2016, 303 research programs were founded in Slovenia, of which 38 were in the fields of medical science with the largest amount, the financial researches being assigned to microbiology, immunology, neurobiology, and oncology. Ladies and gentlemen, the Inter-Parliamentary Union, as a global parliamentary organization bringing together parliamentarians from all over the world, is an important factor in the effort to deliver constantly higher standards and healthcare. However, it is on us, the parliamentarians, to introduce the necessary measure into national legislation and through control mechanism monitor their effective implementation. Thank you.
Thank you very much for reminding us of some different aspects of health, like you mentioned, aging, and the greatest challenge and opportunity that we have because of the aging of the population and the need for new treatment and new treatment options. I'd like to also take this opportunity to say to the floor, if some of you have prepared statements, if you would like to share them with the Secretariat so they can be part of the recollection of this discussion, and also this may also help you to remain within the max 3 minutes that we are asking you to. If I can give the floor to the distinguished representative from Jordan, please.
Shukran. Thank you. Thank you very much. Thank you, Flavia, for your excellent work, as usual. I think there are many challenges, and the health field is one of the most important and most risky. I think it is too risky to leave health to politicians. The participation of scientists and experts and research is extremely important, but there are 2 sides to this. There is the scientific and research side, which is an experience that the whole world contributes to. You have scientific research from all over the world, regardless of the national, any kind of national jurisdiction. And the second side has to do with statistics and reality on the ground. And this is where we as politicians play a role. In Jordan, we have the Central Bureau of Statistics and the Higher Council for Population that provides us with information, allowing us to develop a clear health policies. I want to talk about one thing, and that is early marriage and child marriage. In Jordan, we have witnessed an increase in this phenomena in recent years, and after proper analysis and research, we discovered that more than 44% of child marriages or early marriage is these marriages happen between Syrian refugee girls. So this required that the parliament and the government should take the necessary steps. So we issued new regulations for marriage of girls that are between 15 and 18 years old. We added 3 conditions: that the spouse or the husband is not married, because, as you know, in Islamic countries, according to the Islamic jurisprudence, polygamy is permitted. So if the bride is between 15 and 18, then he should not be married, and that she should not be less than 15 years of age. And the third condition is that she should be able to go to school. We started with these, we introduced these conditions less than a month, and we hope that they will contribute to decreasing the number of child marriages and women who marry between the age of 15, or young girls who marry between the age of 15 and 18. years. Recently, we had an experience with academics, researchers, and scientists who wanted to push the parliament to pass legislation for mental health. We formed a joint committee with the scientists, experts, psychiatrists, psychologists, all the stakeholders, and as well as a committee of politicians, parliamentarians, so that we can be informed about what is the situation to help us develop proper legislation. Of course, we need each other. Both of us need each other, especially that politics sometimes can result in the return of several epidemics. Like in Yemen, cholera is now an epidemic, and we thought that we forgot about it a long time ago. The same happened with polio in Jordan in 1998. We had polio cases in the refugee camps, and we immunized more than 1 million children, refugees and Jordanians, in 2014, and we managed to cut this epidemic short. So the same also applies to Iraq. So I think politics and science are very connected, interconnected.
Shukran jazilan for this important conversation and testimony, particularly from a country where you have demonstrated as often the health problems are not confined by borders. And you're given the examples of how child marriage, in fact, was happening more in the population that you had that were Syrian refugees, and now this is often seen as, in fact, a protection for the Syrian families that were coming into the Jordanian territory. We have now the United Arab Emirates, the distinguished colleague. Please, the floor is yours.
Thank you. Thank you, Madam Chair. Ladies and gentlemen, the wise leadership of the United Arab Emirates gives special attention to the sector of health and research. Health is on top of the priorities of the national agenda to achieve the vision of the United Arab Emirates 2020. We have an increase in expenditures on the health sector in the UAE. And based on our recognition of the importance of health research, we have promulgated several laws and legislation pertaining to scientific research and intellectual property rights. We have also acceded to several international conventions, as well as signed several agreements in this regard. We're also trying to move from dependency on oil to knowledge-based economy, and this has made a contribution towards increased research in the medical and health field, which we consider to be a basis and a cornerstone for the development of this sector. The United Arab Emirates established several research centers. His Highness Sheikh Mohammed bin Rashid Al Maktoum, the Prime Minister in the United Arab Emirates, launched the National Strategy for Innovation 2014 with a time frame of 7 years, and established a fund for innovation for 2 billion dirhams that aims at taking innovative ideas and making them a reality. We have also started a section or a directorate in the Department of Health pertaining to looking at new and innovative ideas in the health sector. We have also launched several prizes in this field. Ladies and gentlemen, parliamentarians have a role to play in developing the health sector and its policies through their role in terms of legislation and enhancing and enforcing policies. And in the United Arab Emirates, as parliamentarians, we find that what's important are the following. We need to pass laws and legislations pertaining to the health sector. Parliamentarians need to visit health centers, health research centers, to take a look at their strategies, to be informed about the research, and to ensure that they are sent to them, that they read them, to give proper direction and legislation. Parliaments should sign MOUs with the accredited health research centers to create links and synergies with them. 4, to urge the government to create an effective partnership with the private sector and civil society organizations and encourage them through giving incentives. And 5th, the Parliament should be taken into consideration when the government budget is discussed. The Parliament should take into consideration that there are proper and sufficient allocations for the health sector. And in case of any violation, then the government should be should be questioned. We've also should encourage more research in the health field. And finally, parliaments should take into consideration the need for legislation that regulates clinical tests, whether on humans or animals, and that guarantees the application of principles of human rights as well as animal rights guided by international guidelines issued by WHO as well as other international conventions. Thank you.
Thank you so much, and thanks so much to the wisdom of the UAE leader for establishing the Innovation Fund. That is really an important development that I think will assist many, many other countries, not just your own, sir, in advancing that, and also for raising the importance of the clinical research, because that also, again, has to be guided by the public interest, not just by the private interest. That's quite important to underline. If I may ask the distinguished delegate from Pakistan, please.
Thank you very much, Madam Chair. Health systems around the world are constantly challenged to ensure access to safe and effective health services for those who are in most need. The major part of this challenge is related to the strengthening of health systems based on research and scientific evidence. Therefore, we need robust scientific evidence to inform the legislation and policies in terms of health system strengthening. At institutional level, parliaments face numerous constraints while performing this function, and their ability to apply scientific evidence in oversight and legislation is often restricted due to lack of resources and insufficient research and library services. Therefore, parliaments will have to bridge this gap, ensure that health laws and policies are constantly backed by scientific finding rooted in and responsive to national need. This requires greater attention to the reforms in parliaments which can result in greater availability of finances and strengthening of the structures like parliament research services. In the Senate of Pakistan, substantial changes have been taken place since the assumption of charge by the incumbent Senate leadership. Recently, the Senate Library has been upgraded, which had a modest beginning back in 1973. It now has been expanded to more than double its previous space with enhanced IT, referencing, reading, and seating facilities. It now offers a far more enabling and conducive environment to promote and encourage intellectual inquiry as per our vision. Access to reliable and timely information is essential for the proper functioning of democratic legislatures. Information explosion has made the role of parliamentary library and research services more important. As parliaments need filtered information that is timely, accurate, and politically neutral. Keeping this in view, we have also taken the initiative to embed a section of Senate research services within the new library in an effort to complement and strengthen much needed symbiotic connectivity between the two essential parliamentary services. This will also facilitate the honorable members to access authoritative, independent, and relevant information as well as timely research support under one roof, which will enable them to conduct informed legislation and perform their duties in a scientific manner. Thank you very much, Madam.
Thank you, distinguished delegate from Pakistan. Distinguished colleague, we have half an hour to go and we have 11 delegates that haven't spoken, and I would like to give the floor to the panelists for a a short reflection or comment or reaction before we close, and at 6:30 we have to go. So I'll have to remind, please, if you have a written speech, give it to the Secretariat. We'll be able to have it reflected, and kindly stay within 2 minutes, because some of the richness, in my experience, of this discussion and debate is to be able to listen from many, many parts of the world. So with that one, please, if we can hear from distinguished delegate from San Marino.
Yes, thank you very much. Science and research have the fundamental role to transfer their findings into society. This can be achieved at several levels, from industrial stakeholders to communities and social wealth, and in different ways, such as application to specific fields, dissemination, communication to public audience, and the result. Therefore, science and research are fundamentally important for the improvements of quality of life and human development. In this regard, applications to improving health standards have several applications. First of all, communication at large scale of populations regarding global illnesses, and therefore the prevention countermeasure to implement. Secondly, the cures that can be developed in order to cancel definitely some mortal diseases. In addition, new techniques in many fields, as surgeries, therapies, and treatments, can improve the efficiency of the existing ones. Finally, application of science and research can be oriented in solving the controversial issues in bioethics and genetics. The parliaments all over the world should disseminate and communicate to their citizens the potentialities of science and research in order to spread all these fields and achieve the highest standards and improve quality of life. Thank you very much.
Thank you so much for having touched also on the important aspect of bioethics and how that reflects in this dialogue between science and politics. The distinguished delegate from Sudan, Mifadlak.
We can't hear the speaker. In the name of God All-Merciful, scientific research is a basic requisite and requirement in this age because of the role that it plays in achieving the highest benefits. Since health care is necessary for development and for achieving sustainable development, we find that we need national research centers to be supported, especially in low-income families, because we find that advanced or developed countries have benefited from achievements and discoveries and new medical technologies. And with those new developments, they have improved their health standards and quality of life. And there are lots of research that not only focus on medication, but also general health. And this research is of special importance to improve public health and to improve the quality of the health sector, to try and reach better standards in terms of efficiency and sustainability of the of health services. In Sudan, over the past 20 years, we've suffered an embargo. Despite the siege, despite this embargo over 20 years, we had close cooperation between us and the World Health Organization, which has led to developments and enabled us to overcome diseases like polio and meningitis and AIDS. And we have reached a point where we managed to get rid of polio if it wasn't for the new migration from sub-Saharan Africa and other African countries. So we would like to request greater cooperation between countries and to try to have control over the borders. The world is a small village, and you cannot stop someone from coming to your country. But we need to have health guarantees, and we need to have research in the health field. We need to have cooperation with different health organizations, health research, and between the countries to overcome these diseases and these epidemics. In Sudan, we have allocated a huge budget for research in general and health research in the health field in particular, and we hope that we will continue to develop in this field. And thank you for listening. Thank you very much.
Shukran jazilan, and I definitely vouch for the incredible collaboration between Sudan and the World Health Organization. And I remember managing with you the epidemic of meningitis among children. And now, fortunately, as I mentioned before, you have the vaccines that can prevent and save your children. Can I please ask the distinguished delegate from Panama to take the floor?
Sí, gracias. Buenas tardes.
Thank you and good afternoon. Thank you, Madam Chair, Ms. Flavia Brusteo, and I'd like to thank all the panelists and fellow parliamentarians. In Panama, when it comes to the health code, which deals with health issues in our country, the main point is primary attention and providing attention. So we have to have a complement within that, which is we have to have a link between the scientific and Parliament. So we need to have a commitment so that we arrive at the right answer. After so many years, so 30 years since we discovered HIV/AIDS, and we've only had a few treatments, and now we're starting with the development of vaccination. Why didn't we deal with it in the same way that we dealt with vaccination for polio? Thank you.
Muchísimas gracias para la brevidad y para su intervención. If I can please ask the distinguished delegate from Iran, you have the floor.
A statement will now be read by the delegation of Iran, a prepared statement.
I would like to inform that the Islamic Republic of Iran is one of the most advanced developing countries in the world in the term of the providing its people with the basic healthcare services. We make sure that even the most vulnerable people have access to the health services. Medical research and education have been investigated with the health system. Most of the science achievement in the field of the medical sciences have been realized through the education system or being directly transferred to the health system. These have become possible through passing of the different fine-tuned and the appropriate laws and regulations in the Islamic Consultative Assembly. A variety of the important in the Islamic Consultative Assembly, including health and treatment, have played important roles in information and development of the national policies, legislation, and strategies in the field of the health and treatment. These causes examine the executive structure and the expenses made by the Iranian Ministry of the Health that submitted bill via amendment drafted presented by the member of the Health Treatment Causes Committee for this Islamic Consultative Assembly has attempted to utilize the latest information and science achievements in the course of the development, national policies, legislation, and strategies in the field of the health and treatment with the ultimate goal of satisfying the public health and requirement and overcoming the present challenges. We do believe that know-how, technology transfer are crucial to achieving the internationally agreed objectives in developing countries, in particular in the field of the healthcare treatment and medical education. Scientific finding must play an important role in formulation of health-related laws and in the parliaments. Through the Inter-Parliamentary network, and parliamentarians could have shared their most effective legislation. This could improve quality of legislation and laws developed around the role of the technology and achieving health objectives. I thank you for your attention.
Thank you so much. And you reinforce also the issue that were raised by someone before you about the importance of technology transfer and how this is important for trying to have some equity in the world of the access to newest technologies that are available. If I can have, please give the floor to the distinguished delegate from India, please.
Thank you, Madam. India is proactively promoting science research to increase access to sustainable and quality healthcare for its people, with greater focus on those faced with multiple challenges on the healthcare front. India's National Healthcare Policy 2070 aims at promoting a multiple disciplinary approach toward the health research and guarantees that provision of adequate funds for the purpose of the medical innovation and drugs research. We in India are taking the parallel initiative in healthcare. Efforts are being made by all stakeholders, including the parliamentaries, to promote modern healthcare technologies in the area of diagnostics, treatment method, and diseases prevention. In our country, at the apex level, the Indian Council of Medical Research has the responsibility to promote biomedical research. The Council priorities including giving impetus to research and innovation to deal with the healthcare challenges faced by all sections of our society, especially the underprivileged. Recognizing the extremely deprived condition of our tribal population, which survives under the most challenging and difficult circumstances and suffer from various diseases. A tribal health research forum has also been set up to deal with their specific health concern. Over the years, the successive government in India have been able to bring about remarkable improvement in the health infrastructure. Besides promoting mobile as well as online health services with the help of space technology tools, our government has also been encouraged the development of affordable ingenious technology for the production of drugs and medical services. We have international fellowship programs in addition to fellowship programs within the country to enable medical graduate and other in similar field to train themselves for biomedical research. Moving beyond research, we are constantly and diligently trying to effectively translate the outcomes from research into the action by suitable and the appropriately building skill human resources in the area of healthcare so as to achieve the best possible health standard for the benefit of our people. Thank you.
Thank you so much for that contribution and also for all the work that India has done over the year to actually avail the knowledge and the know-how and the medical research as you have explained. If I can please give the floor to the distinguished delegate of Morocco, please.
Merci, Madame la Présidente.
Thank you, Madam Chair. Dear colleagues. No one can deny the importance of scientific research for decision-making in terms of standards and policies for health. But we have to think about health risks that are linked to illness and also the environmental dangers and those linked to food. And we have to face this, and we have to think about that we ensure that food and medicines are without danger. We have to look in particular at information, and we have to think about what we've heard about vaccinations that are compulsory and which have been adopted by the WHO. We have to think about vaccines like the flu, influenza vaccines, but the pharmaceutical industry directs the business purely for commercial interests. And now there are natural medicines which can work instead of pharmaceutical medicines. There are certain medicines for arthritis and so forth that can be used with the natural remedies and overcome these illnesses. For instance, in terms of cholesterol rates, this is something we can look at in scientific evidence. So we have a duty together to look into preventive medicine and to include nutrition and sport, because they play an important role, because it's possible to live to the age of 100 in perfect health. Thank you. Thank you, says the chair.
And just for all the distinguished delegate information, at the World Health Organization we have a committee that we call SAGE, the WISE committee, that enables us to formulate the recommendation for which immunization, which vaccines are actually ready for being introduced in your country. And the critical aspect of that committee is that it's completely independent from the Secretariat of the World Health Organization, is completely independent from the pharmaceutical industry, and it conducts its discussion in public. So if you would like to hear, they are actually going to be in session in 2 days, and you can hear the discussion in a very transparent manner, precisely as you have called, sir, because that is important that there is no disinformation.
Now I will give the floor to the distinguished delegate of Algeria. You have the floor.
Merci beaucoup, Madame.
Thank you very much, ma'am. You know that Algeria is a country in North Africa which is 2 million square meters and has some 1 million inhabitants. In 1962, we had 300 doctors in Algeria. Now we have 45,000 who are practicing and 48 who have been exported generally to developed countries. This is quite a paradox. In terms of our health system, we have a health system which is based on insurance along the Bismarckian lines, and so access to care is fully free of charge for residents and non-residents of Algeria. So given this extraordinary rapidity in terms of change with illnesses, in particular with contagious illnesses and the illnesses that we regard as non-transmissible, NTDs, we are looking at the non-transmissible, non-communicable diseases, in particular cancer, as being a major problem. Now, if we look now at the links between science and policy, there is not just a double link, but a triple one. And that's because the Parliament is not the decider. It is government and presidents who are involved. I was a scientist attached to the Dean of the Faculty of Medicine, and now I am a member of Parliament. So I'm rather at the center of this whole issue, and I'm also responsible for the 2015 to 2019 cancer planning for the country. When we've had scientific and policy reports that we've requested be under the responsibility of the President, some reports are sent to him directly through both the government and Parliament. And at parliamentary level, we have put into place with scientific societies a scientific monitoring group to ensure that we apply all scientific knowledge in the field. It's true that science based on the highest level of evidence, evidence-based medicine, is currently a dogma. We need to be careful to ensure that science doesn't become a pure dogma as it is, as we have with politics and also with religion. And so we currently, from a general point of view of the discussion, we have to look at the relationship between policy and science. And Max Weber, a German philosopher, has looked into this in great deal. And it's not simply a binary relationship. Scientists also commit errors, not just on a scientific level. They're human beings, even if they have a great deal of statistics on their side. It's not them who do the work on the statistics. That is robots that do it. we forget the human dimension, and the ethics behind that. And behind that, we have the various elements and inputs from society which can be conscious and subconscious. So we can't look at a pure scientist to deal with two scourges, which aren't necessarily medical. They're social scourges. We ourselves have created them. Cancer, as the Anglophones say. Human beings have, in the role of scientists, to give examples through their tolerance and must not be the givers of lessons, because we've paid a high price in the past. Thank you very much.
Merci beaucoup pour votre sagesse, pour votre expérience.
Thank you very much for your wisdom and your great experience, and to have explained those various roles for us. I think it's a very rich discussion that we can have here in meetings of the IPU.
Floor to the distinguished delegate from Korea. You please have the floor. The Republic of Korea.
Thank you, Madam Chair. I am Se Jung-woo, a member of the National Assembly of Republic of Korea. I'd like to point out the importance of the media to adopt right policies based on science. I'll take the example of the anti-smoking policy to illustrate my point. It has been scientifically proven that tobacco and smoking are bad for the health. And many studies show that if we raise the price of tobacco, the smoking rate drops. And the World Health Organization recommends that price and tax measures are an efficient means to reduce the demand for tobacco. However, many politicians are hesitant to adopt high pricing policy of tobacco. I think one big reason is that some media portray tobacco as a favorite good for low-income people or smoking as a comforting habit for people under stress. Hence, high pricing policy of tobacco is often regarded as a policy that goes against the low-income people, and this view often wins over any scientific evidence, which is happening now in Korea. Therefore, I think it is important to persuade media people to enforce really good policies based on scientific evidence. And I think to do that, we need to provide a platform of discussion upon which researchers, media people, and policymakers get together and try to make a consensus on good policies based on science. I think this also applies to the case of pandemic as well. Thank you for your attention.
Thank you so much for highlighting the critical role of the media and how that importance of how the informations are conveyed for the public to understand them and also for the policymakers to make the decision. If I can please ask the distinguished delegate of Indonesia to take the floor.
Thank you, Madam Chair. Allow me to emphasize that economic and health are inseparable, especially for women. Research has demonstrated that improvements in female health can stimulate economic development, as healthier females have better access to the labor market and higher earnings. The Indonesian House of Representatives supported the implementation of the universal health care. The National Health Insurance Program was launched in 2014, and by September 2017, it has 180.7 million participants, or around 70% of Indonesian populations. The target is reach the entire population by 2019. We encourage IPU member countries to boost trade in pharmacy and to make them affordable. We also support the development of R&D on health and sharing best practice among countries to control communicable diseases. We further emphasize the need to develop cross-sectoral collaboration for health equity through comprehensive training and study exchange on social determinants of health. The health law mandated the allocation 5% of the state budget for health improvement. We have accomplished this mandate since 2016, in which 60% of the allocated budget will be spent on prevention of diseases and health promotions. We support research and development of vaccines and medicines for the communicable and non-communicable diseases that primarily affect developing countries, providing access to affordable essential medicines and vaccines. In accordance with the Doha Declaration on the TRIPS Agreement and public accordance with the Doha Declarations on the TRIPS Public Health, which affirm the right of the developing country to use to the full provisions in the agreement on trade-related aspect of intellectual property rights regarding flexibilities to protect public health and in particular provide access to medicine for all. Thank you.
Thank you so much for also raising the importance of evidence and knowledge in economics terms, because those are very often the ones that can really influence the decision makers and particularly the financiers. So distinguished participants, we have actually come to the end, which is a really wonderful and rich discussion. And I'd like to close giving each of the panelists 1 minute, no more, because we are just in zona Cesarini, as they say, just really at the end. And if I can please start with the Honorable Minister from Zambia, one reflection or one provocation that you would like to leave the audience with, please.
Thank you very much for the interventions that have been made. I just want to say one little thing, that one of the interventions that brought the press on the table, I think, was extremely important, because the press destroys and builds. And I think one of the problems that has happened in a lot of our countries is how the press has been able to destroy some of the efforts that researchers and parliamentarians and legislators and executive try to do. So I think this connection of not only looking at science and research as important, without bringing all the key players to the table, may not be that useful. And because usually press does what's called sensationalized reporting. But in science and research, it has to be factual. And I think we need to always carry the press with us. The last point that I want to make, I like this example of tobacco. And a lot of us, especially the executive, we are more interested in the money that comes out of tobacco. But we are not looking at the destruction that tobacco is doing to our society. And I think Parliament must really push this agenda by getting as much research information on the numbers of cancer that people are dying from, lung cancers, as a result of tobacco. And since they play an oversight role over the executive, Parliament really should push for proper laws and policies around the issues of tobacco. And I think the bell that is ringing in this room is just the importance of putting science, research, technology together and use it to the best of our ability as legislators. Thank you.
Thank you so much for that wisdom, Onorevole Locatelli.
Microphone, please, for the speaker.
Two colleagues. First, to our colleague Kakektil, he said, not for him, my elections are coming, first. And to the reaction of our colleague, Dr. Millet, today elected president of our advisory group. By the way, congratulations. He said, no matter of these topics, no matter of discussions, matters of decision to be taken, of course, on a scientific base. The problem is that in these years, surely in my country, in the 20, 25 years, politicians who are the leaders, because that's their role, to play the role of leadership, are very often playing a role of followship, in the sense that we make investigations, also with the use of social, and then we take decisions on the basis of the mainstream. And not always, as we have seen in the case of vaccines, the mainstream is the right one. So we must be clear, because we try to give responsibilities to media, as our colleague from Korea said. True, but a part of responsibility is on our shoulder. And I finished my time. One more thing. I want to thank the colleague from Jordan. I raised the topic of more than 40% of child and forced marriages in the refugee camps of Syrians in Lebanon, or in Jordan. It's a real problem. Sorry, we have no time. I don't agree much about the measures you foresee to counteract. We can discuss about it, but it is good that... You can discuss
it at dinner.
No, but it is good that you find what the situation is like. It is the first step to address one of the saddest among the saddest phenomenon, child early and forced marriages. Thank you.
Thank you, Onorevole Locatelli. If I can come back to you, Professor, for 1 minute, please, because we are really finishing.
Microphone, please, for the speaker.
Sorry, I think it has been a very important session, and I go back with a new acquired refreshment of commitment to do my work. I want to address 2 points that I hear from the audience that I believe pertain to some of the reflections that I have been doing as I have been hearing and thinking about these matters. One is we must really look at the youth of our nations. With the technology information and the amount of information that exists today, we need to really realize that our nations have to become autonomous in terms of intellectual property. I think this is one of the greatest problems we have. There is a vast gap between developed nations and developing nations in reference to intellectual property, and we need to promote creativity and innovation in our societies. And we don't need to be hopeless about it, because it won't happen in 1 year, 2 years, because it didn't happen in developed nations in 1 year or 2 years, but eventually it will occur. And I think it could be accelerated by the amount of information that we have today. And the last point is to make, I want to go back to the question of the common good, that at the end of the day, we all have to think about the common good and not be afraid to compromise in our actions, in our sayings, and publicly in trying to look after the common good. Thank you.
Thank you so much, Professor. And Prandeep, if I can come to you for your last minute, please.
Okay. Thank you very much. I heard 3 key words. One was the whole role of technology that was raised by many people. I think one concrete action, I think technology, it's changing the world, but it's not changing the health sector enough. It's not changing the way we engage with each other enough. It's not changing the way researchers engage with implementers enough. So how can we use technology and connect across countries? There's no reason why research today has to be the domain of only one part of the world or one country, but how can we start connecting each other? So that's one thing which it would be really wonderful to hear from you as you move forward before the elections to make some decisions. Number 2, I think I heard the word innovation. I think there are so many innovations out there. We need to invest much more in innovations, and not just in innovations for the sake of it, but innovations that will solve the real problems on the ground. And in order to do that, the one word which I didn't hear was communities and civil society. How can we really engage communities and civil society to take the power that you have, the resources that are there, how can we use that to translate into results for the people who need it? So how can you facilitate that? Because without that, we will have great policies, we'll have wonderful resources, but it won't reach the people who need it. I'll stop there.
Thank you so much, Prandeep, and thank you so much all the distinguished delegates that have taken the floor. I think this session is really a result of a lot of exchange, and I felt very privileged to have the opportunity to be with you. I think I'd just like to conclude with reminding everyone that living a healthy and fulfilling life is actually a basic human right. Is fundamental to the achievement of the Sustainable Development Goals that all the countries in the world have actually subscribed to. And you know it, but just let's remind ourselves that parliamentarians are uniquely placed. You have a clear mandate to prioritize evidence-based actions and investment. I want to underline that, investment, financial investment, decisions that protect that right, that fulfill their rights, and it is to the benefit of everyone in the planet that leaves no one behind, because this is the key essence of the struggle you are conducting within your own countries, but also that we are all adhering to within a globalized world. With those words, I'd like also to close with a quote that is from a distinguished president, that is Nelson Mandela, that used to say that there is no keener revelation of the soul of a society than the way it treats its women and children. I end the quote. Thank you so much. And we are on time, Alexandra. Thank you very much. Thank you.